First, let me say that I find it very disappointing that the CDC has not yet shown up here. My understanding is that Dr. Gerberding was going to be out of town, but her deputy accepted, and now it turns out that both she and her deputy are testifying in the Senate. And I think we deserve equal time, and one of them should be here now. And that empty chair is a visible reminder of the fact that the CDC has a lot of work to do here. So I'm very disappointed. My impression from talking to the witnesses in advance and from the reading that I have done on this matter is that a lot of blame is being put on this particular CBP agent who didn't do his job well enough, although he was an 18-year veteran. I'd just like to suggest that the blame game is not a good way to handle this, and I did mention that to the witnesses. I think we had a meltdown here, not that everything went wrong, but that a lot of things went wrong, and this could have been much more serious because had this fellow had a real, and he could have, communicable disease, his form of TB apparently wasn't communicated to anyone, or hasn't been yet, but had it been, or had it been smallpox, or had it been something else, we could have right this minute a national, major national emergency, both in health terms and economic terms. So I think that the potential here is very serious. My question to these witnesses is, if your sister or your wife or your mother had been seated next to Mr. Speaker on this airplane going to Europe, or his airplane returning to Canada, what would you say to them? Would that affect your view?
Congressman Harman, it's important to understand that in this particular case, the individual left the country before anyone knew about it. And I would say to my family member sitting next to that person, it's unfortunate that this person chose to be irresponsible, not to comply with clear instructions from his doctor. And moreover, let me point out that the treatment of TB across this country is really based on a relationship between physicians and patients in an area of trust. People can abscond with this infectious disease anytime. So it is unfortunate that he was not more forcefully kept from flying in the first instance.
I know that's what you feel, but let me just take this a step further. Your sister or your mother or whomever comes down with some very drug-resistant disease, having been seated next to someone who somehow fell through the cracks of our system. And you're in the hospital with this person who may have a life-threatening disease, and you're going to say, gee, sorry, sometimes these things happen? Or would you say something, let me just ask the other two witnesses, would you feel differently about it if it personally affected one of your close family members?
Well, I certainly would try as best I could to explain what happened and why it happened, and that the failure for us to stop this individual from traveling is inexcusable. I can't make an excuse for that. I can't make an excuse for us not interdicting this individual when he came back into the United States. We are now, obviously, this has told us that we've got a lot of work to do here. We've got a lot of communication that we need to improve upon. As Dr. Runge has mentioned before, we are engaged with the CDC. We are engaged with the Canadian government now to talk about how we can better improve the territorial boundaries of North America. This has resulted, in my opinion, in an awakening that we need to do a better job. And I'm not going to sit here and say that the system worked, because we know that we can improve upon the system. It may have worked the way it was designed at the time, but now we recognize it was not good enough. And we are working very hard to ensure that that communication that Dr. Runge talked about is not at the local level. It does go to the national level, that we do put a national response to something, an event like this in the future.
Mr. Chairman, my time has expired, but if the last witness has an answer, I would hope you would accommodate that.
I'd be happy to. And first, let me answer the first question you posed, which is, how would I feel? I would certainly make sure that if it was a family member of mine, that they not overreact to something that could or could not be a health risk. I would want them to follow the appropriate medical care to determine accurately if there's a concern. But to your question, how would I personally feel? I feel very personally concerned with how our performance for our frontline people were and how this agency performed. I am the responsible person for this organization, for our ports of entry, and we didn't execute well enough. So I feel very personally concerned with how we performed.
Thank you. Thank you, Mr. Chairman. Appreciate that.